This video will be demonstrating how and where to palpate certain muscles dealing with the knee joint. You're going to start with the sartorius muscle, which we previously covered with the hip joint. The sartorius muscle is palpated approximately just medial to the tensor fasciae latae and is palpated superficially. You can feel that sartorius ranging right here from the outside of the hip, and it comes all the way down across the inside of the knee. Next will be the gracilis, also covered with the hip joint. Palpated is a thin superficial tendon on the anteromedial thigh with knee flexion and resisted adduction. So that knee flexion, again, will be that. Resisted adduction will be going in. And the gracilis is found coming from pubic bone, and it comes all the way down the inside of the thigh, all the way down around to the bottom part of the knee. Next we have the biceps femoris. Biceps femoris is posterior lateral aspect of distal thigh with combined knee flexion and external rotation. So again, we'll do the knee flexion, external rotation, rotating outward. And with that, we can find the biceps femoris coming from about here, and find it coming all the way down to right there. Excuse me. Next we have the semimembranosus. This is largely covered by other muscles. It's felt at the posterior medial aspect of the knee. The semimembranosus is found at the base of the pubic bone, and it runs down along the inside of the leg, kind of closer into the femur, and it comes down around the bottom of the knee as well. The semitendinosus is posterior medial aspect of the distal thigh, and this one runs similar to the semimembranosus. Kind of shies away from the femur a little bit, but it comes down from the base of that pubic bone. It comes down around just on the bottom of the knee as well. Next we have the rectus femoris. Straight down the anterior thigh from the anterior inferior iliac spine to the patella with resisted hip flexion. Hip flexion would be this, and knee extension would be that. So as we raise that knee up, kick that leg out, we can find the rectus femoris. Just a minute. Struggling to find it. That rectus femoris comes from outside the hip, and it comes down all the way across the knee, underneath the kneecap, down to the base. The vastus lateralis is slightly distal to greater trochanter than the anterolateral aspect of the thigh to the superolateral patella with extension of the knee. So let's get the knee extension, which is just not thorax flexion, extension. You just straighten that leg out, and we can find the vastus lateralis running down the outside, and it also cuts behind the patella as well. The vastus intermedius starts on the femur. It is anterior medial distal 1/3 of thigh, just above the superior medial patella, and deep to the rectus femoris with extension of knee, which I have already demonstrated. And it runs down, kind of goes behind the patella as well, and it's right there. The vastus medialis is anterior medial side of the thigh, just above the superior medial patella, and deep to the rectus femoris with extension of the knee, which again I've already demonstrated. And it runs from just the top of the femur. It comes down alongside it, down around the knee, the patella, down to the bottom of it. And last we have the popliteus. It's with the subject sitting down, which I have this chair right here to demonstrate. Subject will be sitting down, the knee will be flexed at 90 degrees, and we will palpate deep to the gastrocnemius medially on the posterior proximal tibia, and proceed superior laterally toward epicondyle of the tibia. This one's kind of hard to see. It's found in the back, so I'll kind of look my leg up a little bit to show you. It can be found just back here, the back side of the knee. And that's all we have for today.